Hello all, I'm going to demo my project MedAccess Advisor. So let's get started. Okay, so healthcare in America is broken, not just in cost, but in complexity. Most patients receive an expansion of benefits letter or an insurance denial and have no idea what it means. They don't know they might qualify for Medicaid. They don't know the drug company will pay for their medication if they just ask. Today I'm showing you a mid access advisor and an AI agentic built with Google's agentic development kit that gives every patient access to the kind of guidance that used to require a healthcare insurance consultant. Let me show you how it works. So the agent is just a minute. Yep. So the agent is a secure multi-step process. Every query before any agent model ever sees it passes it through a security checkpoint. This layer scrubs the PII, detects prompts, injection attacks, and blocks clinical advice requests that are outside the scope. The clean query then goes to the orchestration agent. That delegates to either a policy agent for the terms insurance terms explanation or a assistant agent for drugs programs and Medicaid guidance. Both subagents are backed by the MCP tool servers. High sensitive responses get flagged for human in the loop review before they reach the user. Let's try to see a live demo. So, oh, just a minute. So if we go out here, I did try before. I'm not sure that I might be able to uh, run through everything through tokens. So I'm just going to demo what I happened. So this is how the launch page will look like. And when you start asking a question, it is going to give you an answer and also an explanation of what the summary is as well. So let us do one thing. Let us try and see whether that works. So this is the entrance for the app. So let's run a query and see what happens. So when we run this, uh, notice what just happened. The query passes the security checkpoint, and you'll be able to see that the server log that was classified as info with no PI deducted, no injection attempt, and no clinical uh, advice flag. The orchestration routed it to the policy agent, which caused the explanation policy terms tools to retrieve an authoritative definition rather than generating one from memory. The final response explains clearly what the benefits, uh, the concepts clearly explain in plain English. No jargons, no confusions. This is what a benefits counselor would tell a patient in plain English. Let's try one more query. So we're going to ask the income is so and so for per year for the family of three in Texas. Do I qualify for Medicare or not? Let's see what we get back from the solution. Let's wait. Now we can see that the agents, what the assistant agent does. It calls the medical eligibility with the income and household size parameter, cross references to the Texas Medicaid income limits, and tells the family whether they qualify or not and what their next steps are. So it gives you the final response in and also asks whether they can approve or deny as well. So let's approve and see what happens. So yep, this is what it is. So it says you cannot definitely say the policy information is not available. Oh, so okay. So maybe the coverage just needs more details, but it does give you a exact output of what is required. Let's go through one more example. So we are now asking question about a prescription assistance program, whether it's available or not. And let's see what the response has done. So the search drug assistance tool returns manufacturer PAP program, copay card options, and links to the needs medicines and RX assist. Immediate manufacturer AbbVie offers a patient assistance program for this. Maybe this is not approach. So let's go for the next one and see what happens. I think so. We have hit a security block request. Mhm. Let's do it. Let's launch it again and see what happens. So So in this example, you can see that it cannot, its security checkpoint classification is being reached because outside the scope of the LLM to answer the question. That's why when we ask the question of whether I have a chest pain, what to be done, it blocks and says that it can't give you any suggestions on that particular query. So let's go and try this example and see what happens. Technically, this should also have given an answer, but this is not happening. But this is what the whole checkpoint uh, does. Uh, so let's go to the closing and see what to be done. MedAccess Advisor demonstrate that the agent built with the ADK can be powerful and safe, helpful, and responsible. In 30 seconds, it took the answers each of these questions a real patient might have spent hours on hold reading forms given in entirety. This is what the agent for good means, using AI to remove barriers that prevents real people from accessing healthcare they have already earned and paid for. Thank you. Most of the post-demo Q&As are already answered as well. You can go and check all those things. But this has been entirely built using Gemini 2.5 Flash by default. And I didn't, most of them was just agentic coding, nothing to do with uh, physical coding myself. Uh, thank you.